So what do you do when you have a seizure? The first thing is don't panic. How you can help a person who's having a seizure is clear out the area around the patient so that he does not sustain any injuries from any harmful objects. For example, if the patient is near a pool, make sure that he does not fall into the water. If he's near a fire source, move him away from the fire source. Or if he's near any sharp objects, move them away from the patient. Ask the passers-by to give some space so that they do not crowd around the patient. And more importantly, turn the patient towards one side so that this patient, whatever secretions that tend to accumulate in the mouth, that they come out of the mouth and they do not go into the lungs and cause pneumonia. Also, what you can do is that avoid putting anything in the patient's mouth like food or water, thinking that this might help the patient. And there is a superstition that if you give the patient some kind of iron in their hand, that the seizures would terminate. That's not exactly true, because seizures eventually do stop on their own, and people assume that putting something in their hand like iron is causing the seizures to stop. So sometimes instead of doing the things that I've advised, people tend to just go searching for an iron key or something like that. So it is better to avoid such superstitions, follow these instructions that I have given, and sometimes your doctor can prescribe you a nasal spray which can be puffed into the patient's nose to prevent a seizure from occurring again and again, also to cut short the duration of the seizure that the patient had. And sometimes in few patients, if they can get a premonitory symptom where they know that they were about to have a seizure, they can sit down where they are so that they do not have falls and do not injure themselves.